All right, welcome my friends to episode, can you believe this, 691 of Extreme Health Radio. This is amazing. We've been able to do this show for almost 10 years now, which is amazing. So if you guys want to grab the show notes for today's show, I'll put everything that we talk about, links to Dr. Steenblock's websites and all the cool stuff that we talk about, the sponsors and everything else, at extremehealthradio.com/691. And I'll mention that throughout the show so you don't forget that number, because I know that as a lot of people do, they'll listen to podcasts and radio shows when they're driving or working out or whatever. So we'll make everything available to you at that website, extremehealthradio.com/691. I hope you guys are doing great. I hope you're staying sane and staying level-headed as much as you possibly can during this big C, little v, what they're calling a pandemic. I hope everything is going well for you and things are going good, because I know that these days it is wild and crazy out there with everything we're hearing on the news. So let's see, got a lot of cool things coming up. If you are new to the show, we do broadcast every Friday morning. We're not live anymore. We may go back to live. I'm not sure. I'm still considering doing that. But right now we're not live. But the shows come out on midday on YouTube, as long as they allow us to have an account, midday on YouTube on Fridays. Then the audio podcast version comes out on Sunday evening. So if you subscribe to the show, what we're doing is brand new episodes come out every Sunday morning on iTunes, or Sunday evening on iTunes. And then 6 days a week on the other 6 days, we're doing our best of episodes. So make sure to subscribe for shows 7 days a week so you don't miss anything of what we're doing. Got a lot of cool stuff happening. Wow. Okay, so we've got a lot of cool things to talk about today with Dr. David Steenblock. He's been on the show, I think this is his third time on the show, and he's a local guy. We're here in San Juan Capistrano, and he is in San Clemente, California, at least his office is. His website is strokedoctor.com, and he is the president of the Steenblock Research Institute, and he has a degree in osteopathy from the College of Osteopathic Medicine in Des Moines, Iowa from 1970. So he's been around for a while working on all kinds of cool things. And we talked before the show, before we started recording, about all the different treatment protocols he's doing, from stem cells to hyperbaric oxygen chambers to all kinds of really unique and innovative approaches to healing, probably that you may have never heard of before. So this is what we like to do, is bring people on like this who are doing some really out-of-the-box, unconventional things that your medical doctor's never heard of, and offer these as options to you so that you can feel like you have more power and more control over your health. So let me bring on Dr. Steenblock, turn his audio up. All right, Doc, how are you doing today, my friend?
I'm great. Thanks for having me.
Oh, so welcome. And so I was mentioning today, I think this was the third time on the show, and you've been researching and doing stem cells, and gosh, you're doing all kinds of crazy treatments there in San Clemente, aren't you?
Yeah, well, I don't know if they're crazy. They're very logical and proven by research articles. But, there's a big jump between the research and the clinical practice. On the average, it's anywhere from 20 to 40 years after a new fact is discovered and would seem to have clinical utility before the doctors accept it and start to use it. So there's that big gap between, for example, in 1968, the first hyperbaric oxygen treatment was used on a stroke patient, 1968 in Detroit. And then it really... if you look at the literature now, I just saw an article by some doctor this morning. He says hyperbaric oxygen for stroke was first described in 1990. Okay, well, there's a big difference. And this is a guy now 20 years, whatever, after 1990. And they're still wrong, and they don't even have it. And he's writing the article, and he didn't go back to find out that it was in 1968. And the reason I know is because in that time, I was at the Mayo Clinic doing a clinical rotation in oncology, and my aunt happened to be there with having had a traumatic brain injury and stroke, and my relatives were asking me what to do, and so that's why I started looking at hyperbaric at that time and found out about that case in Detroit. So all I'm saying is that there's a big jump between what's been shown to work and what is being used to work in the clinical practice of medicine.
So interesting. So with your aunt with the stroke, what's going on? What's the mechanism of action when it comes to hyperbaric and stroke, and what's happening in the brain when that happens?
Yeah, that's a great question. For many, many years, it was thought that stroke and you had a stroke, there was nothing to be done. The tissue was dead, nothing could be done about it. And then in 1981, 82, some researchers down in San Diego came up with the idea of what's called the ischemic penumbra, which means that that the central core of the stroke area, you have a blood vessel that's blocked, and that blood vessel has been supplying blood to a certain part of the brain. Well, it's sort of like a tree. And so you have a big trunk, which is your artery, and then it goes into the tree branches. And if everything is working well, then those tree branches, those tiny little branches, supply blood to the brain. But in this stroke, then that main trunk is blocked, and all of those capillaries or small branches no longer get blood supply. And if that were the case only, then they'd be right that there's nothing could be done. But it turns out that there are other little tree branches and trees that go into the same area. So you have duplication of blood vessels into the areas of the brain. So it's not one area is not getting supplied by only one supply of blood, but by 2 or 3 other supplies of blood. And so when one artery is down, the other supply blood, and so that they may not supply enough. And that's the case. In general, they're not supplying enough. And so that tissue that's been injured by the blockage of the one artery, they're still getting oxygen and they stay alive, but they are not functioning well enough to do their job. And so you wind up having paralysis and whatnot because the fact that these blood vessels, the cells are getting some oxygen to stay alive, but not enough to function. And so by giving a person hyperbaric oxygen, high pressure oxygen, they're breathing oxygen, the oxygen goes into the blood, into the plasma, and is carried into those damaged tissues, even though there may have been a blood clot, because the oxygen can dissolve in the blood and rather than be carried by red cells. So generally, the red cells can't get into the damaged tissue, but the plasma can with the oxygen. Once it gets into that tissue, then it gives the oxygen to those damaged tissues. The tissues are able to revitalize themselves and start to function again. And if you do it over and over again, it becomes a permanent fix and a permanent improvement in the stroke patient.
Wow, that's interesting. So you're able to actually regenerate tissue and cells that have been dead from the stroke.
No, not dead, damaged and lacking enough function. The ones that are dead are dead. The dead ones happen in 10 minutes. In other words, there's absolutely nothing that can be done for a stroke patient in that central core of dead tissue. It's over. Nothing ever will bring that back because it's dead. Okay, dead, dead, dead. And now, but around dead tissue, these tissues, now that dead area swells. And if you go back to Richard Nixon, when he had his stroke, he, remember he was, maybe you're too young for that, but as he was hauled off to the hospital, he was awake and alert, and he put up his hand and gave us all the V signal that he was going to be victorious over it all. And then within 24 hours or so, he was dead. And the reason was because that central core area was not treated by the doctors, and they didn't know what to do. And so, at the time, probably still too, they didn't know that there's this ischemic penumbra, and you could have fixed that with hyperbaric oxygen and compression. I just saw, today, I was looking at hyperbaric oxygen and stroke. The latest article on stroke still does not recognize that acute stroke can be handled and treated with hyperbaric oxygen. And the reason is because none of them seem to be smart enough to figure out or have done it. I have done it. You have to be a patient. You have to be the doctor. You have to be there with the patient. You have to treat them and look at them, watch them. And when you do that, you learn. And I learned long ago that when you're treating a patient with an acute stroke, you have to treat every 4 hours if you're going to change the course of the event. If you're going to reverse it, like I started off, my first case that I got interested in this whole thing was back in 1991. And I had a patient who was something like 72 years old, had all kinds of problems, atherosclerosis of the carotids, of the heart, couldn't be operated on, and came to me and I said, well, you got to do this, you got to do that, and like change your diet and do some chelation and whatnot. And she refused. And 2 months later, she's in a coma in the emergency of our local hospital. And her daughter calls me and says, what to do? I said, well, why don't you put her in an ambulance, sign her out against medical advice, bring her over to my office. And she did. Can you believe it? And here she comes with this comatose mother. in an ambulance. And we picked her up, and we had enough people at the time to do it. We picked her up, put her in a gurney, brought her in, put her in the chamber, and cranked her up and treated her. And after an hour, she didn't get one bit better. And I'm going, oh, damn, they're going to put me in jail and throw away the key.
Oh my gosh, right?
Yeah, I'm a total criminal at this point.
Yeah.
I better start putting my thinking cap on quick. And so I just had quite a kitchen, medical kitchen, where I had all kinds of little tools. And so I put together this great concoction of all kinds of things, like mannitol and magnesium, and it goes on and on. Anyway, so we did that, IV of that, and then also we use a pulse magnetic field therapy on the back of her head to increase the blood flow to the area. And so we did that for hours, put her back in the chamber for another hour, and this time she got better. I said, well, damn, that's working, so let's keep doing it. So we did that routine, that IV, then the hyperbaric, IV, and the hyperbaric every 4 hours around the clock. And so she came in about 10 o'clock in the morning, and at 10 o'clock the next morning, she walked out of my clinic back together as if she had never had a stroke.
Oh my gosh. Doc, I bet you were just going crazy in your head, because you're probably thinking, oh man, I'm going to lose my license. I'm going to go to jail. Golly, that must have been stressful for you.
No, it was a fleeting moment, a fleeting thought. I did not let my thoughts get carried away. But I'm pretty good at an emergency. I did emergency medicine for many years, and you can throw all kinds of stuff at me, and I can handle it. So, problem.
That's amazing. So with the case with like a stroke, so you said you mentioned every 4 hours for someone. How long generally after a person has a stroke do they have to be able to use hyperbaric oxygen with success, do you think?
To get it to reverse like that, it has to be within 24 hours. After that, it becomes, you may as well just go back to I do 2 treatments a day after 24 hours, and I do that, if I can, for 3 weeks. And if they do it twice a day for 3 weeks, in general, you're getting them at that point about as good as they're going to get. Now, if they got more time and more money, I would give even more. And even then after that, maybe give stem cells too, to help them as well. So, and then again, what caused it. So if, for example, if they have atherosclerosis of the carotids and of the brain, then, and they have hard arteries, I might want to encourage them to do chelation therapy, which is using a chelating agent, which is this word, chelios. Chelation comes from the Greek chelios, or to claw. And so this molecule claws out toxic material out of your arteries. Things like calcium, calcium deposits are a major factor in aging and cell death. So you want to, and the arteries, as you know, people always talk about the calcified arteries. There's a test called a quantitative calcium coronary artery scan, which is a great test. Anybody out there who has not heard of it, they should look it up. A quantitative calcium coronary artery scan gives you the simplest, cheapest, most effective way to detect if you have or are developing heart disease. And I would not go to a cardiologist and ask him. He will tell you you're crazy and I'm a quack. But I started using this test in 1991. I used it, and it was called a quack, until 2012, when the American College of Cardiology said, oh, guess what? It actually is true, and it actually does work, and now insurance pays for the test.
Oh, my goodness. Wow. That's amazing.
Wow. It's amazing. And the doctors still deny it because they don't make any money. I was just in to see a cardiologist, and I developed a little bit of what's called a supraventricular supraventricular-ectomy. And I said, well, let me just go. I walked into this cardiologist, and he didn't want to even talk about why I thought I had it, what I thought was causing it, how to evaluate it, how to do it, anything. He just said, we need to do a stress test. Well, a stress test is $6,000 right out, out the door. And so I'm saying, excuse me, why am I don't have heart disease. I know I don't have heart disease because I've just had I've been following my heart for many years. So I know I don't have any kind of serious heart disease. So it's a waste time and money, and he didn't want to even talk about it. He wouldn't do anything. I said, well, I just walked out and I fired him as a cardiologist. I don't need people in my life who don't know anything and don't want to learn anything.
Yeah, I hear that. I hear amen to that. So, with your hyperbaric oxygen chambers you have there at your clinic, typically, is there a difference between the level of stroke people has, the type of stroke they have, and do you correlate that to the pressure and the time and the protocol that you use for each person?
Well, you can, but it's more productive to do it safely. And
Okay.
so over the years, people like Dr. Richard Neubauer down in Florida, Paul Harsh in New Orleans, and I have we've been kind of the three leaders in the world in hyperbaric oxygen, and we've discovered that if you just stick with 1.5 atmospheres and 1.5 hours per treatment, you have a generally very good result with minimal side effects. I mean, virtually almost no side effects ever. And so that's a good protocol. Now, saying that, I'll say this, that if a person comes in who's had a stroke 3 years ago, and they come in and they want to do my 60-day program, and after 3 weeks, I haven't seen, and they haven't seen, or 4 weeks, if they haven't seen much result, I'll go from 1.5 up to 1.3, 1.75 for another couple, 3 weeks. And if then they still don't, then we're at 6 weeks. We still have maybe 3 weeks, 4 weeks to go. And at that point, if everything is going well, I'll then go ahead to 2 ATA. And when I do that, I do get results. So it's you do see better results as you kick it. Then again, you don't want to do it unless you really need to, because the higher you go, the more side effects you can have.
What kind of side effects would they be?
Seizures probably would be the number one. And so
Okay.
these patients that have had a stroke 2, 3 years before have got scar tissue in their brain. And so by doing it in this gradual way, that pretty well obviates that possibility, because the brain gets adjusted to this oxygen by doing it. If you just hit them the first day with 2.0 atmospheres of pressure, you can oftentimes, in those cases, within 3 treatments or so, you might cause a seizure. Now, the seizure is just a seizure, and generally it's short acting and doesn't last too long, and you just decompress them, and they're fine, and they don't have any more sequelae or more seizures at all. But you want to protect them from it, and saying that you also want to treat them with vitamin E and magnesium, because that helps prevent seizures for the normal person. And you're pretty sure that they're having tendencies towards seizure. You put them on anti-seizure medicine, because that does not stop the effectiveness of the hyperbaric oxygen.
That's interesting. Are there cumulative effects for using hyperbaric oxygen therapy, you think?
Well, depends on what you're talking about. We're now, I don't know if you saw that paper that just came out a couple of months ago out of Germany, where they did 3 months of hyperbaric oxygen, and they were able to show, by way of a variety of tests, blood tests and whatnot, on their telomeres and stem cells, etc., that when old people like me are put in the chamber on a daily basis, you're able to reverse the clock by about 10 to 15 years. And so when you do that, you see things like your hair on your head that's bald now starts to grow hair again, and your face starts looking younger again. Your heart starts getting healthier again. If you had congestive heart failure, your congestive heart failure starts to go away. If you have any chronic infections, that goes away. If you have autoimmune diseases, that goes away. So there's all kinds of benefits that you can get from repetitive hyperbaric oxygen.
That's fascinating, because what we're essentially doing with this hyperbaric oxygen is forcing oxygen into the cells so your body can utilize it. I would imagine that this effect would have a really systemic effect on a wide variety, not just strokes, but all kinds of different disease processes, right? Or health challenges.
Oh yeah, yeah. We do it. Alzheimer's, for example, generally considered not treatable by hyperbaric, because what's happened in the past, many doctors who do hyperbaric, and I'll say the two I mentioned, Richard Neubauer and are not holistic doctors. I'm a holistic doctor. And so that means that I try to look at everything, try to treat the whole body. I started the first holistic medical clinic in the country back in 1977. And so I've been doing this for a long time, trying to identify all of the different factors and what can we do with each person to optimize their healing. And sometimes you have to really look at a lot of different details. But with the use of hyperbaric oxygen, you could just as well treat. Sometimes, for example, with the autoimmune diseases like systemic lupus, rheumatoid arthritis, multiple sclerosis, are all considered to be in part due to chronic infections. And the only trouble is it's almost impossible to identify the infection and where it is. And so if you just put them in hyperbaric oxygen for like 30 treatments, and oftentimes just that alone will literally cure the autoimmune disease. Now, when I say that, I'll have to admit my patients that come into me are not just routine. They usually have tried everything and done everything. And so, and if I could, at that point, after 30 treatments, I would throw a couple vials of stem cells, because that too, I have seen very good results with shutting down the process and putting them into a cure. For example, I have one patient here locally. She lives in Irvine, and every year she sends me a little birthday card of thank you, because 11 years ago, she had multiple sclerosis and was not doing well at all. And I treated her with just stem cells, and she's been in remission ever since for 10 years now. So you do see a good result with stem cells alone, but the combination of hyperbaric oxygen to get rid of the infection first, then the stem cells would really be optimum. And it's all safe, rather than spending, like the hotshot standard doctors now are calling for doing stem cell treatments for these patients, but they want to give you high doses of chemotherapy, kill all of your bone marrow cells, and then throw in cells again. The cost is about $160,000 to $200,000, and there's a pretty high rate of death with that whole process. Makes no sense to me that you do that as compared to just having simple hyperbaric oxygen and stem cells. It's comparatively very cheap and much, much, much safer, and as I would say, much more effective too.
Do you think medical doctors will ever come around? Because you mentioned, at the beginning of the show that they said, 1990, but really it's 1960. In the 60s they had hyperbaric oxygen. Do you think the medical industry will ever come around to the benefits of this? Because it does. If they can't make money, I wouldn't think so. But I don't know.
Amen to that. I'd like to see somebody go around and do like some kind of informal, secretive poll where the doctors don't tell us their names, and just ask them, what is your great concern about practicing medicine? Is it making money or helping people get better? Which is more important to you? Mm-hmm. But it's making money.
Oh man, it probably is. Yeah, well, I mean, I feel bad for doctors because they have a lot of student loan debt to pay off. They got a lot of houses to pay off, a lot of medical bills, insurance.
They got a lot of don't talk to Mike. They got Mercedes to pay for. They got fancy houses to pay for. They got country clubs to pay for. Don't give me this threat. Having I had a high student loan. I paid it off. So it took time, but I made it through. And I paid my way through medical school, about half of it anyway, and the rest was student loans. And I worked. So I worked my way through both college and medical school. And so, if I can do it, and I'm not that smart, I was just motivated. When I started school, I said, I'm going to do this or die trying. And I literally meant it. And so if I died trying, I was going to die trying. And I came close. I didn't die, and now I'm a doctor.
That's amazing. So we're talking mostly a little bit about stem cells, and we'll get to that in a little bit, but we're talking mostly so far about hyperbaric oxygen, and I know you work with both. Are there any other treatments, or is that sort of the core of your protocol, or do you work with other treatments as well?
Oh, yeah, I got a lot of treatments. Where would I start? We have external counterpulsation. That's a device that uses blood pressure cuffs, really special blood pressure cuffs on your legs and hip. Mm-hmm. And that there's a machine that is connected to it that compresses these blood pressure cuffs, pumps them up so that they compress your legs and from the feet up to your hips. And it does it just after your heart contracts and pushes the blood down to the legs. So as the blood gets to the legs and down to the legs, then this machine turns on and squeezes the blood so it goes backwards quickly. And when it does that, it goes to the heart. The aortic valve is there and it shuts. And so then that pressure coming back from the legs goes into the coronary arteries and expands it and causes the formation of new blood vessels if you do it on a daily basis. And you wind up with having what are called collaterals, which increases your blood supply to the heart. And so that will reverse congestive heart failure, and it opens up the coronaries. So if you're having angina and coronary artery disease, that will go away usually within a week, so the pain goes away. And so now, in addition to that, that same process goes to the brain, so you can have an effect on the lower brainstem and the area of Parkinson's, and you can get blood flow into the brain in that way too. So you can help treat the stroke patient with that lower brainstem stroke and or any kind of disease like Parkinson's as well. And then if you have chronic kidney failure, it helps regenerate some of the kidney as well, and the other internal organs. So, and people always ask me, what of all the devices I've got, which would be the one alone that would be really, really good for anti-aging? And I always tell them the external counterpulsation, because the fact is that anything you can do to increase your metabolic efficiency is anti-aging, and that's what this machine does. It increases the capillary density. That means there's more capillaries per cubic centimeter of tissue in your body after a course of these than if you did before. And aging is associated with a loss of small capillaries throughout your body, your brain, your heart, And the reason for that is number one, you're getting older, and so that the cells are not working as well. And two, your stem cells are not working as well, and they make growth factors. And so your growth factors, which make new blood vessels, are lower and less. And for example, I did a study comparing a newborn baby with a 90-year-old and found that in the newborn, the number of growth, there was about 30 growth factors I measured, and they had on the average 10,000 micrograms per deciliter of these different growth factors. Mm-hmm. In a 90-year-old, instead of 10,000 micrograms per deciliter of growth factors, these 90-year-olds had 100 micrograms per deciliter. So in other words, there's virtually no growth factors in an old person, and you cannot repair yourself and regenerate when you have no growth factors. So now, saying that, I'll tell you another little secret, and that is if you look up on Google what animals and what plants live forever, you will find that the ones that live forever, which means, relatively speaking, like the bristlecone pine is now over 4,000 years old, still alive, same one, hasn't changed, didn't go out and hydrate or, have sex with another bristlecone pine. It's the same tree that is still alive after 4,000 years. And the reason for that, and for the other plants and animals that continue to live, is that they all are continuing to grow. And growth means that you're making new tissue, and that helps you stay young. And it works in humans, and it works in everything else. So what you need to do is keep your growth factors high, and you do that by getting rid of all the toxins and the poisons, getting good exercise, and things like the hyperbaric oxygen, stem cells, ECP, all these different things. Anything you can do to do that, then you see that you're going to see your body turn around, and you're going to change back to maybe 10, 20 years ago kind of situation for yourself. I call this whole process youngering. And so I invented the term to indicate that it's an active process of reversing aging.
Yeah, it's interesting. So obviously with aging, your body's ability to create ATP in the mitochondria is affected, right? And so if there's less energy, there's less ability to create these growth factors like you're talking about. How does the mitochondria play a role in these growth factors, do you think?
Well, the mitochondria get old too. And so they have mutations, they start to not regenerate what is it called, mitochondria, let's get the term, mitochondrial genesis, I guess. Neurogenesis and mitogenesis, I guess. Anyway, the point is that the mitochondria are extremely important, and you can, this like hyperbaric oxygen helps pick up them and helps them restore and regenerate and grow more mitochondria. So, all of these things all work together, and mitochondria are oxygen dependent, just like the rest of the cells. And so, And you have other factors too that are involved. You have the phospholipids. For example, people who eat fatty foods, especially saturated fats, will have more and more hardening of the arteries, and the cell membranes of the mitochondria become harder because the saturated fat becomes incorporated into the mitochondria as they form and regenerate. And so you wind up with mitochondria with hard shells inside, and those mitochondria have these little tiny lipid bilayers inside of them, which is where all the metabolic activity occurs. And when those have all become hardened because of the saturated fat, they cannot bend and move like they normally can. I don't know if you ever have seen mitochondria on YouTube, but they have, if you go to YouTube, they have, if you put in mitochondria and like mitochondrial transport, you'll see videos of mitochondria just flying down axons of nerves and moving greatly so that they can move anywhere in the cell within a second or two. I mean, the mitochondria inside of a cell are very active, and yet we just think of them as their mitochondria because what we see are pictures of them and not seeing them in a motile state. But these guys are very motile, but with saturated fat they are not, and so they can't do their job well, and so that causes a decrease in efficiency of the cell, which causes the loss of ATP. And if you have a loss of ATP, repair it, and if that's the case, anytime the cell membrane is damaged, calcium from the outside goes in, and that poisons the mitochondria even more and will kill the cell. So all of it's all related, and like I say, the less toxins you have in your body, the more oxygen you can get in, and the more, this also comes down to what's called adaptive medicine. And adaptive medicine is like exercise. You go out and run, first time you haven't run for a while, you go out and you can run maybe 20 feet. And by that time you're puffing and going crazy, oh, I'm gonna die. And so, but okay, so do it the next day, you do it again. Now you go 30 feet. Pretty soon you're out doing 2 blocks, and then you're a half a mile, etc. Mm-hmm. What's happening? Your body's adapting to this physiological stress. And by doing that, now it's not killing you, but it's making you, every time you do it, it hurts. So adaptation is generally something that winds up causing a little bit of pain. And so but the pain is something that tells the body you got to do something, get your act together. And so in the exercise case, you have aches and pains in your muscles, etc. But the next day or 2 days, that's all pretty much gone, and you go out and do it again, and your body's stronger. And so that's adaptive medicine. Anything you can do to strengthen that or do more of that adaptive medicine, then the better off you are. Now, speaking of that, we do have another machine, which is called high altitude training, and you can look that up on Google, high altitude training, and we have a machine that you just sit here or lay here. We have you can do it either way, but just let's say to do it the standard way, just sit in a chair. You can buy it and keep it at home and put it in your living room. And so you just put it on your face and leave it on for an hour every day. And every 5 minutes, it will take you from sea level oxygen up to the top of a mountain in terms of oxygen. So in other words, it goes from normal to low levels of oxygen. And that low level of oxygen stays there with you for 5 minutes. And then you're back to sea level at normal oxygen. And you just keep doing that for that hour. Well, every time you go up to high altitude, that's a stress. And that's a hypoxic stress where your body is not getting enough oxygen. And that causes the formation of what are called hypoxia-inducible factors. And there's about 760 of those genes. They're all involved with making new blood vessels. And so by doing this, you're making new blood vessels form. But you have to do it over again every day, and at least for 3 weeks. And if you do that every day for 3 weeks, you can have a real great generation of new blood vessels. And that is one of the best anti-aging therapies and probably the most inexpensive therapy you can get for an anti-aging overall helpful in terms of your overall health. What does it do? It helps with angina. I've seen a reverse angina, coronary artery disease. I've seen it help with COPD. I've seen it cure bronchitis. I've seen it cure asthma. I've seen it help allergies, and it goes on. Muscle wasting, sarcopenia. And you can look that up too. There's all kinds of papers on it. Hypoxia, high altitude training is what it's called. And the reason why it got started a long time ago, it was back in, when was it? It was, oh golly, 1970 Mexico City Olympics. And they were held at high altitude. And so all the Olympic athletes got really turned on about high altitude training because they were going to go there and compete. And so that got the Olympic committees and the people involved kind of interested in this high altitude stuff. And so then this machinery came along. A friend of mine helped develop it out of Russia. He was working in Moscow at the time, and he and I came up with the same idea in 1978 to do this kind of therapy. And but I was in pathology school and training and my residency at the University of Oregon when I had the idea, and he was working on he had his PhD about that time in Russia, and so he spent his whole life doing adaptive medicine, and he actually started the International Academy of Adaptive Medicine in 1993, and I had him come out to Colorado Springs in 2001 and give a 2 days on high altitude training for all the doctors and whatnot. But it has never really caught on by standard doctors here in this country. But there's books on it. You can look up the books. There's one or two published by Springer, one in 2012, etc. Lots of research. Anyway, it's very safe, simple. The machine costs about maybe $6,000. There's two machine companies. One is Hypoxico, and the other one's Go to Altitude. And so at least then there's maybe one or two others. But in any case, a very great technique. Anybody who's got chronic health problems, you can come into my office, try it out. Now, in my office, I've got it made a little differently than what I've described. I have that device, but then I combine it with pulse electromagnetic therapy and infrared, near infrared lights. And so I have the person stripped down to the bikini or shorts. And so I have their whole body being exposed. And so they're getting, and then they're getting electrical stimulation going from their hips down to their feet, which stimulates and releases bone marrow stem cells. So the whole thing is made to release stem cells out of your bone marrow and circulate them and stimulate them to be activated to replicate and grow and become stronger. And so that is like $100 a treatment an hour. So you come in for an hour, lay there and do all these things, and you do it every day, and you'll see really great results of that. So you get a combination of both the high altitude and the bone marrow stem cell release technique. So that's enough. Now I invented that. Nobody else has that in the world.
No, that's amazing. That's amazing. We're going to take a little break right now. I hope you guys are enjoying this show with Dr. David Steenblock. We'll put a link to his clinic's website. There's a number of different websites we have for him, but I'll put a link to as many as I can. One I know of off the hand is strokedoctor.com. But I hope you guys are enjoying the show, and this is episode 691. We're going to take a little break right now, and I want to tell you about hydrogen. Now, this is an amazing machine that we have. It's called the AquaCure, and this is an incredible, incredible substance. Hydrogen has been used for quite some time now. We had Tyler LeBaron, the head of the Molecular Hydrogen Institute, and there's over 1,000 articles on the benefits of hydrogen gas and breathing hydrogen gas, and it's the world's smallest antioxidant. It's 400 times smaller than vitamin C. 700 times smaller than CoQ10. And what it has the ability to do is to actually go into your DNA and repair the DNA as well as the mitochondrial DNA as well. And the name of the game here is reducing oxidation and rust. And let me play you a little clip I think you'll enjoy from our friend Nathan Walls over at Journey to Optimal Health when he was on our show talking about molecular hydrogen.
More than any supplement. I do take some supplements. Most of the supplements I take are on the short term. When I fly, I do molecular hydrogen because that's really a good quencher of free radicals, especially a lot of the free radicals made from EMFs. And when you fly, you get exposed to a whole bunch of EMFs. But here's a hack, because molecular hydrogen is not super cheap, but your body also makes molecular hydrogen. And the best way to do that is by getting infrared light on your gut. So that light, it penetrates into your gut, and your bacteria are able to liberate or pull out molecular hydrogen from your food.
Yeah, this is incredible substance, guys. Molecular hydrogen. Here's our friend Brian Hoyer. He's a building biologist, and what he does is he works with the people with EMF exposures and goes to their homes. In fact, if you want to schedule an appointment for him to come to your home, he routinely does tours throughout America at different times of the year, and he'll come to your home, which he did to our home, and spend about 4 hours at our home and teaching us how to mitigate a lot of the EMF. And in any event, here is him talking about molecular hydrogen. Interesting and fascinating.
And then there's other mitigation strategies that I'm working on for outdoors, and there's different things you can do to mitigate some of the damage. You know, one of the things that Dr. Mercola recommends is molecular hydrogen, and that's actually been shown to basically mitigate 80% of the damage of free radical peroxynitrate, which stimulates those which is created from the stimulation of those voltage gated calcium ion channels. And so drinking molecular hydrogen when you're acutely exposed to those frequencies can help.
Yeah, so like I said before, what it does is it helps repair the mitochondrial DNA and reduces oxidation inside the body. And we know that oxidation is one of the main causes, some people argue the main cause of all disease. And so having a tool like this at home is incredibly beneficial for you to be able to bring in this molecular hydrogen. Now, this AquaCure machine actually makes Brown's gas, which is a step up from standard molecular hydrogen. But the benefit of this is that you can make your water and you can bubble molecular hydrogen gas into your water, and then you can breathe it. So you can drink the water and bubble the gas. You can even do innovative things like Rebecca was talking about in our academy. She bought one of these machines, and she actually takes baths with it, or has taken some baths with it. And you can bubble this into your bath water. It's really an incredible device. The AquaCure machine, check it out. It's in our store, biochargeme.com. Comes with a lifetime warranty, and it includes parts, labor, and shipping. There's a 100% satisfaction guarantee. George is such a great guy. So if you have any issues, call him up and he will honor the warranty for you. And I really recommend bringing some of these tools into your home. And here's something else too that I wanted to tell you guys about too. This is the Magnetico Sleep Pad. And a lot of people are worried about 5G, wireless radiation, WLAN, dirty electricity coming out of the walls. If you look at your walls, for example, in your home, you have tons and tons of electrical and magnetic fields coming off the wires that are coming out of the wires in our homes. And these are coming off the walls, and we're affected by this. We had Professor Martin Paul on the show talking about kind of what David Steenblock was talking about, the cell membrane. And when that breaks down, calcium floods the inside of the cell where it doesn't belong. And when that happens, Dr. Paul was talking about hundreds of diseases stemming from that. And so it's a really big deal. And so one of the ways that I protect myself is by sleeping in a magnetic field. And we had Dr. Dean Bonley on the show talking about the Magnetico sleep pad that he made. And we have the 10 Gauss. But check this out.
I just heard those devices that you had during the break, by the way, and I actually want to add to that because that's really cool stuff. I actually have the Magnetico sleep pad myself. I've got the 20 Gauss. It actually is really important. And what's happening is with the Earth, according to research and some pretty good science, that the poles are actually wandering. Instead of being sort of perfectly aligned and opposite of each other, there's multiple poles on the north and south, and they're actually wandering around. And basically what that does is it decreases magnetism around the Earth, but it does so in an uneven way, in an undistributed way. So it's not exactly uniform around the planet. What's happening is we are getting extra solar energies coming to the Earth. So we're actually seeing like UVC is now increasing on the planet because of our magnetic field. Our magnetic shield is not as protective. So it's really interesting stuff what's happening as we're moving into new parts of the galaxy, and we're getting new energies and all this stuff is changing. So I actually have a Magnetico sleep pad.
Yeah, that is a great spot by, I forget what his name is, but he is the head of Jason Prahl, the head of the Human Longevity Project, and he's down in Carlsbad, California, and local to us as well. And this is one of the things I always recommend people do is modify their environment, because as Dr. Jack Cruz mentions, the neurosurgeon, is that, we are a product of our environment, and when you can mitigate a lot of what's going on in our environment, 5G, blue light, toxicity, all these types of things, you can really protect your mitochondria from being damaged by these things. And so this is why I always recommend to modify your environment. And also the first place to start with your environment is those areas in your home or your workspace where you spend the most time. And obviously sleep in the bedroom is going to be a big one. So if you can optimize that, that's going to go so far for helping you improve your health, because you're spending a third of your life in bed, 8 hours a day in bed. So it's really important to make sure that you're healing your lymphatic system and you're allowing that cerebral spinal fluid to be cleansed out of the brain and to be able to rejuvenate tissue while you sleep and protecting yourself from EMF. And there's even studies that Dr. Bonley has put together showing a detoxification of heavy metals through the use of sleeping in a magnetic field. And this is an awesome product. The Magnetico Sleep Pad is available at biochargeme.com. That's our store. So if you guys want a 10% discount, you can go to biochargeme.com and go to the magnetic or the magnetism section. And there's a 10% discount code for this as well. Now, these come with 2,000 magnets in each pad, and they're heavy. They are really heavy, so you might have to have some help installing them on your bed, but I really recommend that. It's just an incredible product. So, yeah, check out the Magnetico Sleep Pad and get a 10% discount by going to biochargeme.com. If you're watching this on video, there should be links down below to our store that has a link to these products. So make sure to check out that as well. And so we're with Dr. David Steenblock. I hope you guys are enjoying everything that we're talking about. And when we come back, I want to discuss some of what he was talking about before we went live, and that is the big C, little v protocols he's putting together. I'm hesitant to say the word virus or anything like that, because I don't know what's going on with the censorship. It's really quite profound what's happening. So we kind of have to talk in code and can't say the C word and all that kind of stuff. So anyway, we'll be back with Dr. David Steenblock from StrokeDoctor.com right after this.
Extreme Health Radio is your #1 resource for cutting-edge biohacks, news, and information about how to upgrade every area of your health. Subscribe to our newsletter so you don't miss a thing.
Yeah, guys, make sure to subscribe because, like I just mentioned, there's massive amounts of censorship going on. They're deplatforming. It's like the cancel culture these days. They're just canceling everything, deplatforming people that are speaking about things that actually matter. So if you subscribe to us, we may not be on YouTube forever. I don't know. We've built up quite a significant audience on there, but who knows? People are being deplatformed all the time. So make sure to subscribe to our newsletter. And when you do that, you'll get updated on all new shows, past shows, upcoming shows, all that kind of cool stuff. So make sure to subscribe, and that way you can stay up to date on everything that we have going on. And as well, I offer you a nice little discount, kind of cool little thing if you subscribe. I can't tell you what it is in public, but once you subscribe, I give you a nice little discount on something. So I want to make that available to you as well. So this is episode 691 with Dr. David Steenblock from StrokeDoctor.com. I hope you guys are enjoying the show. Let me turn his audio back up. And Doc, before the show, we were talking about the big C, little v is kind of what I'm calling it now, and some things that you're working with in terms of that. Can you talk a little bit about that, or are you able to do that?
Well, there's so much to talk about. We're talking about there's so many C's now that are bad. We got Corona, we got the COVID, we got the cancer.
Oh man, right?
Yeah, they're all bad. Cutting, let's see, that's what other C's are there. Anyway, COVID is interesting to say the least. And besides being deadly as hell. And it's amazing how many people still are refusing to take the vaccine. All you have to do is come into my office and see these people come in their wheelchairs who are normal people, a month ago, and now have had a stroke from COVID and I'd like to die from it, or we're in intensive care with a trach or whatever. And, these people are not faking. This is not the flu. It's extremely serious. Otherwise, we would not have we got 525,000 people dead now. More people dead than all the wars combined. It's crazy. And yet, but in any case, what can we do? We get our vaccine. That's number one. So get your vaccine, for God's sake, please. And number two, we're coming up with. I'm trying to come up with some products that, if you don't want to take it for some strange reason, you could purchase kind of a kit to help you prevent getting sicker. Perhaps, I'll have to say perhaps because there's no assurance of anything. All we can do is say this is our best guess that these things could help, and based on science and whatnot. And then we have the treatment for the person who's actually starting to get the symptoms and knows that they've got exposure. And then we'll have the product for the long haulers. So saying that, then we have to go back to what started it all and what's causing the disease. And so I've been studying that now since the epidemic started. The first time I heard about the virus in China, I started reading every article I could. And now I've read thousands and thousands and thousands. There's about 110,000 articles. And I don't think I've read all of them, but I'm coming close. And that's more than most anybody else can say, because that's been almost full time for me. And I don't just work 8 hours a day. I work 16 hours a day, morning, noon, and night, and Sundays and Saturdays. So I've got a lot of time invested in this whole process. And so it gets frustrating to me when people who don't know anything tell me that they know about, that they don't need to take a vaccine, or they don't know, this or that. And they act like they're superior because they heard something on Fox News. It's just nuts. So in any case, the cause of it turns out, would appear, is that the virus, is accepted into the system, gets into those what are called ACE receptors in the lungs and in the sinuses in the mouth and all that. And then they can get into the tissue. And at that point, then you have some things going on. One is that the cell takes that RNA that is inserted and replicates it and converts it back into more of the same kind of RNA that came in. And then it just kind of fills up the cell and more until the cell has so many of those viral particles, it literally explodes, and those viral particles spew out into the lung, into the alveoli or whatnot, and then they're expelled in your breath and when you cough and all that. So that's one way. And then the virus, as it's growing into the lung tissue, can also then burst, instead of just into the airway, it can burst into the blood vessels. And so once it gets into the blood vessels, then it can spread. And once it spreads to the whole body. But one of the places that it really spreads to that's the most dangerous is the bone marrow. And that's something that nobody has mentioned. That occurred. And so I've been looking at it, and it turns out that the bone marrow is picking up the virus and it's growing in the bone marrow, but in the bone marrow megakaryocytes, but are just continuing to grow, and they release, because they're big cells, and they're releasing these particles of platelets, and these platelets then have the viral particles inside. Now they are not full RNA COVID RNA that is capable of even being tested for, but they're fragments of the RNA. So the megakaryocyte has taken the virus and chopped it up in little bits and tried to get rid of it. Put it in the outer cell wall, and then it's split off and made into platelets. And then the platelets spin out, and the platelets then have been what are called activated by that process. And so when they get out into the circulation, then they can really go crazy and form white thrombi or white clots. And these white thrombi in the lungs cause the shortness of breath, and they're the symptoms, or the cause of all the long haulers' symptoms and whatnot. And so it's just that the platelets are really the major carrier of these poisons. And so my program is going to help stop that whole process, if I can, with nutrition and natural substances and whatnot.
Now, how does, or do I should say, viruses, how are they affected by hyperbaric oxygen, for example, or the stem cells? Are they affected at all?
Well, the stem cells can be affected and made to transmit the disease. Hyperbaric oxygen may actually help enhance it. And so we don't use hyperbaric oxygen for viruses in general. But I think if you do have a good antiviral, it may be, the combination may be good sometimes. But the trouble with that is that we don't know. And so you're just guessing. And so only in a desperate situation, you might try it as a doctor, you've tried everything else, and say, well, what the hell, why don't I try this and try that? I got a patient who's dying, that kind of a thing. But have a person dying, you don't want to try doing hyperbaric oxygen with a virus because they've already done that and it's not been shown to be effective.
Yeah, it's interesting. It's also fascinating too, because when you think about these different substances, like either parasites or viral particles or whatever, and how they're affected by pressurized oxygen, it's interesting to look at all that. I'm sure there's not a lot of people looking into that, is there?
No, I'm just looking at that whole thing right now. This morning, this last 24 hours, it's been mega curious looking at and trying to see the biochemistry of all that. And it's just that alone is very complicated to try to understand how the megakaryocyte works. And so it's like you need a year course in megakaryocyte physiology and biochemistry. And I have to dare.
Yeah, I hear you. It's so interesting. So I wanted to ask you this question, kind of a personal question. I brought it up before we started recording, and that was about my mom. And she wanted to come see you in regards to macular degeneration. She's had multiple chemotherapy rounds and cancers and all kinds of things. And I know that you work with stem cells, and that's what she was interested in. I'm curious what your experience with macular degeneration is with stem cells. And my other question about it is, are you getting those stem cells intravenously, or are they orally through like a supplement or something?
Let's talk about age-related macular degeneration.
There you go.
And so the standard way of treating that is you go to your ophthalmologist, he examines you, he says, aha, you're developing age-related macular degeneration, and we can stop that and help reverse it. And they say, okay, what do we do? Well, we need to give you a shot into your eye every month. And so they give you a shot directly into your eye. They put a little touch of anesthetic on the outer white part there at the corner of your eye, away from your nose. And they give it a minute to numb up, and then they put a 25 gauge or 27. I use a 27 gauge needle, and so just a tiny little needle into the eye. You inject like a quarter cc and fluid, and that then helps stop the growth of these capillaries that are growing or trying to grow and that are leaky. And so the macular degeneration has blood vessels in the back of the eye that have decided to leak. Now, they don't explain to you what's the cause of that. And you never hear the cause of it. Nobody talks about the cause of it. And the reason is because it's not financially smart to talk about it. Now, when I say, because every ophthalmologist who does this is told by the American Ophthalmological Society and whatnot that you don't need to do and shouldn't do more than 6 shots of this stuff for this condition. But I have seen patients getting these shots for 2 years, 3 years. They just every month they go in and give the doctor $4,000 by way of Medicare and insurance. And the doctor says, well, I'll come back next month. I'll see you then. And they just keep coming back, and they stay stable. They don't get any better. They don't get any. And so they're happy because they're not getting any worse. The doctor says, well, good thing you keep coming back, but you get worse. And so they're locked into the system. And so, but I discovered that they're all full of it, frankly. And so I learned this many years ago. I remember just one case as an example back in about 1995 or so, when I was using hyperbaric oxygen for stroke. And some lady who was about 57 years old came into me with, she was really blind and with macular degeneration, and wanted to know, what could I do? And I said, well, let's do this. Let's do hyperbaric oxygen, and let's see what else did we do. We did some chelation therapy, and we had ECP, external kind of pulsation. So those were the 3 things we did at the time. We didn't have stem cells, and within a month, she was able to see. She was able to actually thread a needle with her bare eyes, and that she was legally blind when she started a month before. So after a month, her vision had come back to the point where she could thread a needle. And I have a video of her showing us threading a needle after 1 month of hyperbaric oxygen, external counterpulsation, and chelation therapy. So now, how did that work? It worked because by doing this, it causes, on a daily basis, it causes the formation of healthy blood vessels. And the trouble with a standard patient with age-related macular degeneration is that every night they are being subjected to a lack of oxygen for a short period of time, and that causes the stimulation to make new blood vessels, but it's not on a daily basis. It's irregular and uninterrupted, and so you wind up with on-off stimulation of new blood vessels, and this on-off stimulation of new blood vessels causes the formation of unhealthy new blood vessels which leak. And so that is the secret there, that hypoxia, lack of oxygen in the eye, is the cause of macular degeneration. It stimulates the cells to try to repair themselves, but they are not doing it right because the stimulus, the hypoxia, the oxygen, is only there sometimes during the night, sometimes it isn't, depends on what you eat, etc. And so by giving the person every day a stimulus to cause the formation of new blood vessels and new growth factors on a daily basis, you form new blood vessels that are healthy, and now you have cured the macular degeneration. Now, so that's the story there. Now, you can also, I found later, of course, after I had stem cells, that you can get the same results with stem cells because stem cells give you growth factors on a daily basis without all the rest. And so if I put stem cells into your eyeballs, then that usually takes care of it. Or you can even do it IV if you want to do it that way and get a whole body systemic effect too. So it's the lack of oxygen that causes it, but it's intermittent lack of oxygen, which you can test for by what's called a nocturnal oximetry test. And your doctor should be able to order that. It's about maybe $50, $100. Medicare pays for it. And so it's called nocturnal oximetry, or just the nighttime oxygen test. And your doctor should know about it. If he doesn't, you can always call me. You can sign up to be my patient. I can order it for you that way. And you can find out what you need. And if that's the case, I've actually seen people reverse their whole thing, their eyesight, with just getting oxygen at night. So it's important to know if you have it or not. And so that's important. Now, saying all of that, with macular degeneration, the older you get, the harder it is. And the reason is for that is because your growth factors are not very good. So in general, so if you have hypoxia of your eyes, lack of oxygen in your eyeballs, then the older you are, 80, 90 years old, you're not getting enough oxygen there to start with. And the process of stimulating and making these tissues grow becomes even harder. And they also wind up with having blood vessels to some degree, and that like albumin can escape into the eye and carry with it iron, and then that causes free radicals, and that causes sort of like a rusting effect. And then you have an immunological attack going on, which involves what is called complement. And so you have an antibody attack as well. And so those are complicated issues for the older person, but the person under like 70 in general doesn't seem to have that in my experience, and they have good results with just these therapies that I was talking about. But when you start to getting to be 80, 85, then we have to start thinking about doing more in terms of my young grade program to help clean up the whole body first before we're going to get good results, because just the ECP, the hyperbaric, etc., is maybe not enough to do it unless you do a lot of, like you do the hyperbaric over and over again. And at that time, we didn't know about what I was just talking about before, about how well hyperbaric oxygen does in terms of reversing the aging process. So now with all that knowledge, I would put together a little bit more concise, holistic approach to those older people and their problems.
Yeah, that's so interesting. A couple more questions before we leave, because I know you got a busy practice you got to get back to. I'm just looking at your website, which is really cool, strokedoctor.com, and I'm looking under the conditions tab. And obviously, a big issue with a lot of people is back pain, joint pain, knee pain. And I'm curious what you're doing for those, because under your services tab, you also have PRP treatment. So let's say someone like me who's got a disc issue in my lower back, and you also have, I have a torn ACL. Do you use stem cells? And I'm sure you work with people with these types of issues, right?
Oh, yeah. I think, I don't talk much about it because it's first of all, it's very competitive nowadays with all these quacks out there. There's many doctors who do stem cells who don't know what they're doing, and they're buying from basically crooks, and the companies are doing it fairly illegally often, and they're not doing it according to the FDA, and they'll tell you all kinds of things. Oh yeah, it's FDA compliant. There is no such thing as a lab that's FDA compliant. Okay, that's just a made up term that they use to get you to believe that they're putting together a good product. So you can't trust most of these guys out there that are doing stem cells. You call them up and ask them, do you have a flow cytometer? Do you have a microscope? Do you have a lab tech? Do you have a clean room? They can't. No, I don't have any of those things. Well, they don't. They're just buying stuff from some car salesman and giving it to you, and you don't know whether or not you're giving up. You ask them another thing: are you having to give steroids and Benadryl with the stem cell? If they're doing that, you know that they're giving you tissue that is contaminated with foreign tissue, which is what you don't want. So, in any case, I've never had to give steroids or Benadryl to any of my patients, and I've done over 200,000 vials of stem cells into about maybe 10,000 people. And with virtually no side effects. And saying all that, I can tell you about like knee joint arthritis. It works in general about 80 to 90% of the time. Again, you may have some problem that is not compatible with stem cells because you've got, say, a big chunk of damaged tissue inside of that joint. And it's just rolling around in there, and every time, once in a while, you step and you almost fall over because it's impinging between the two surfaces. Well, in other words, I have to look at the x-rays generally to make sure that you're a good candidate. But if you're a good candidate, high rate of success. How long the pain can go away? It can be 2 years, it can be 5 years. And again, it depends upon what you do. So people have to understand that tissue takes time to grow, and I can give you the seeds. I can put it in a good garden, if you will. And that's basically I use a garden as an analogy for stem cells. You have to have a good garden. You have to have good soil. You can't try to grow stem cells in the junkyard, for example. If you have a junkyard, you got to go in and clean all the junk off, take out all the bad soil, put in new soil, and till it correctly and get it ready. Put the fertilizer on, give it the right seeds, and give it enough water, etc. And then you get a good crop. But otherwise, you don't get a good crop. And so that's the way. Another way of looking at it is newborn baby. Newborn baby doesn't have any infections, doesn't have any toxins, is full of growth factors. And if they have a damage, something's damaged, you give them stem cells and they heal like crazy. They heal sometimes without scars and whatnot because of that. But if you're 90 years old, you've got all kinds of chronic bugs, you got chronic scar tissue, you got atherosclerosis, blood vessels have been damaged, et cetera, et cetera, et cetera. And so when you give those people stem cells, like one vial of stem cells for an old person, like that doesn't do much. For a young person, they cure them or help much, much greater than the old person. So the cleaner your body is, the less infection, the more holistically looked at and treated before you get the stem cells, the better.
Yeah, so fascinating. All the different treatments you're into. And for those that are listening, what I'm going to do is read off a couple of the conditions that are on his website, strokedoctor.com. So he's got Alzheimer's, dementia. So if you're currently dealing with any of these things, back pain, cerebral palsy, heart disease, hip pain, joint pain, knee pain, chronic pain, strokes, and traumatic brain injury, and as well as a whole host of other things. And now I looked on your website, Doc, you're doing virtual consultations too, right?
Yes.
Oh, that's great. So people can get a consultation with you virtually, and are you still doing in person?
I do in person, yeah. Sure, I do that too.
Oh, that's great. That's great. Well, Doc, are there any other treatments, just in closing here, that you're really excited about, something that you're not really talking about, but maybe you're researching or looking into further that you're not currently doing?
Well, my Youngberg technique is, like I was saying, it's kind of a combination of different things, but for example, ALS is generally incurable. And I have come up with, a whole new concept of it, as I tend to do. I starting back maybe, I don't know, 10 years, I discovered or thought that the spinal cord was suffering from, and the tissues around it was being injured or was having pain, and that pain stimulates the formation of what's called tumor necrosis factor alpha. And that tumor necrosis factor alpha, when it's absorbed into the cerebral spinal fluid, causes damage to the brain cells and whatnot. And like it's involved with Parkinson's, it's involved with stroke. And I thought, well, maybe it's involved with ALS. And sure enough, it is. And so then I said, well, what's causing the pain and whatnot? So I started looking at x-rays of these spines, and I found that there's a good correlation between what's called neuroforaminal stenosis in the cervical spine and ALS. And about 90 to 95% of all amyotrophic lateral sclerosis patients have this problem with their cervical spine. So then I started looking at their gut and found that they also had everybody. There's a paper about 4 years ago now out of Spain, Barcelona, Spain, where they showed that out of 62 patients with ALS who they did autopsies on, everyone had yeast infections in their brain and spinal cord and bacterial infections in their brain and spinal cord. Now, I don't think they were active infections, but I think fragments of these bugs were found, and they were identified by way of like fluorescent microscopy and whatnot. So that what it is that these toxins are from these bugs get into the blood and then go from the blood through the cervical spine in through those breaks in the neuroforaminal stenosis. So the neuroforaminal stenosis is like what's called a cerebral spinal fluid blood-brain barrier breach. There's a leak there so that the poisons can get in from the blood into the spinal cord. Once you get into the spinal cord, then all hell breaks loose inside the spinal cord. Now, talking about the spinal cord, again, that's also another interesting fact, and that is that, for example, there's been some studies with electron microscopy showing that these blood vessels in the cervical spine of these people are leaking. And then the reason for that turns out to be that the endotoxins from the gut is causing that. So it all comes down to a combination of gut poisons and the damage to the neck, and that is then causing the whole process. And so you have to clean up the gut, you have to clean up and try to fix the cervical spine. And what we do to treat is to treat with antibiotics and antifungals, and so we have you on that. And then as we do that, we also take out the albumin. Albumin is the major protein in your blood, and that is like a big sponge for poisons and toxins. So it has a 3-week lifespan, and as it circulates for that 3 weeks, it's gradually accumulating toxins, which are these toxins from the bugs. And there's lots of bugs and different types of bugs and poisons. I think it's in the thousands of molecules of different types that have toxicity in the body. And these ALS patients have more than their share. And so what you have to do is get rid of that albumin, because that gets into the spinal cord because of that leak. And so if you clean up the albumin by putting in new albumin, then you're sucking up the poison, and at the same time you're getting rid of the poisons by your antifungals and antibacterial. So after a week or two of all that, your blood is much cleaner, everything's ready to go. And then I do a bone marrow stem cell treatment, take the bone marrow out of your hip, give it back to your IV, and at the end of that, then I give you like 6 vials of umbilical cord stem cells IV, and then we really get great results with ALS. So and that would work for most of all these other conditions as well, because Alzheimer's is associated like that, Parkinson's like that, MS is like that. So you can treat all these different neurological conditions with this particular protocol that I put together.
That's amazing. Gosh, Doc, thanks so much for being here and sharing all that you're doing. Is strokedoctor.com the best place to find you, or because I know you have multiple websites?
No, that's the best one. Just use that. And you have my staff on my office phone number, 949-367-8870. 949-367-8870. So give me a call. If you have a couple question that I can answer in a couple minutes, we won't charge you. But if you start becoming long-winded and have a long history of one problem after another, I'll have to cut you off and say, hey, if you have
Yeah, can't have a 4-hour conversation, right? You got to cut them off at some point.
Once in a while, people do get into that, and it's like, well, listen to me, I'm going to talk. And so they keep talking.
That's
She's
funny.
backed up here. I'm having to take care of. So I have to say, a 5-minute consultation is free, but after that, I'm going to have to stop, cut it off. Okay.
Yeah, I hear you. Well, Doc, thanks again for spending some time with us and sharing with us about all your treatments and cool things you're up to. I really appreciate it. And I'll be in touch with Rachel, and I'll send her the link as soon as this gets published, and you can share it or do whatever you want with it.
Well, I'll see you when you bring your mother in. Hey.
That's right. I think she's in the next couple of weeks, so I think she's got an appointment.
All
This
right.
is great.
All right. That's fantastic. Thank you so
Awesome.
much. Appreciate it.
Thanks so much, Doc.
Have a great weekend.
Okay, you
Thank
too.
you.
Bye-bye.
Bye-bye.
All right, there you go, guys. Dr. David Steenblock. I hope you enjoyed that show, episode 691. What did you think? Interesting tidbits about ALS, right? I have a friend, an ex-girlfriend, whose father passed away from ALS, and considering sending this to her, but it's that's a incredibly debilitating disease, and it's just nice to see guys out there shedding some light on these things that are unconventional. I've got a lot to share, a lot to talk about after that sort of bombshell interview, and I hope you enjoyed it. All right, so we're going to take a little break, and I want to tell you about a way to keep yourself healthy, and that is with a relaxed far-infrared sauna. Sauna therapy has been used for thousands of years, and it's one of the things that I do on a regular basis since learning about sauna therapy and the benefits of it in terms of boosting immunity, increasing white blood cells, increasing immune function. It's an incredible way to detoxify heavy metals, improve longevity. It's just a great thing that we should all be doing on a regular basis. And here's our good friend, Dr. Randy Tent, talking about sauna therapy. Whoops. Looks like it's not playing there. Here he is. Turn this audio up. There we go.
When people talk about sweating, most people, look at this as an isolated event. You're detoxing properly with, the infrared sauna. Making sure nutritionally on the inside, 60 minerals, 16 vitamins, 12 amino acids, 3 essential fats. Making sure that you're closing down those pathways is just as important as detoxing, because when people start detoxing their body, that's chelation. So when people want to come in and do all this chelation, I'm like, you understand, metals and minerals are cousins. I'll be pulling both out of you at the same time. So when you start chelating, these deficient people are just toxic. You're actually even pulling their minerals down at the same time, and they don't understand that. You got to push the machine like the doctors you were talking about, and learning to sweat is a fantastic way to detoxify. They claim you can get about 50% of the poisons out of you through your skin if you sweat successfully. And with you got a very intelligent client audience here, and the more fat you got, the more places you have to hold stuff. You want to try to get as much fat off you can because you don't store stuff. And I wanted to go to the bathroom and show my steel cylinder. I'm going to use the steel cylinder as much as I can because I don't want any more plastic than I have to. And people can talk about a safe plastic, and I understand there's safe plastics, but I don't know if that safe plastic was sitting out in the sun, because I can taste some of that plastic that sits in the sun, and it tastes funny. We gave plastic to our kids, plastic pacifiers to our kids, plastic bottles to our kids.
Mm-hmm. Yeah, plastic everywhere.
And aluminum lined juice boxes that I've seen on the kids.
Dr. Tent's so funny. Yeah, so this is a really great way to detoxify. And guys, I really want to stress to you that, there's a lot of really expensive health tools on the market. And, some of them can range up to $4,000, $5,000, $6,000. Like, we sell these wooden saunas, on our website, and we make them available because they're great. But, this sauna here for $1,400 is the best money you can spend. It's so much cheaper, but the quality is amazing. And the far infrared light, we've done a number of shows. It's really like sitting in a light box and you sweat like crazy. There's very low EMF. What I love about these saunas is that not only are they affordable, but they're portable too. So that means, you can send them to a friend. You can break it down in a matter of minutes if you want to put it underneath your bed. If you don't have a place to store it, you just want to pop it up in about 5 minutes. You can set it up and then sit in your sauna. It's just an incredible way to detox. For me, it's one of the most powerful health tools that I've been doing for the last probably 9 years now since we've had the show, and I cannot recommend these things enough. If you go to our store, biochargeme.com, you'll see lots of different saunas that we offer. The one I use and recommend the most is the Relax Far Infrared Sauna. That's not to say that there's not other great models out there, like the TheraSage. We got that one. We have the wooden ones. We have the ozone steam saunas. We have all kinds of different options. But if you're looking for something affordable, something that's portable, something that's incredibly reliable, I would recommend the Relax Far Infrared Sauna, and that's the one that we use and use on a regular basis. In fact, I was just in there last night, and I do mine about 3 days a week now, and I really cannot recommend it enough. And here's another really great product that we should all be on, because we all have gut issues, right? So here's an incredible product. Here's Dr. Donnie Wilson talking about that. Oh, whoops. That's not playing there. There we go. All right. There we
And
go.
then I encourage, we can talk more about this. What do I do to help people speed up the healing of leaky gut? I mean, you mentioned aloe before, and that is one of the herbs that I definitely recommend, using for helping to heal leaky gut. You want to use herbs that are anti-inflammatory and soothing and healing to the intestinal lining. So aloe is a great one.
Yeah, so aloe should be in all of our protocols, something that we do on a regular basis and to help heal leaky gut. But the problem with aloe, I don't know about you, but if you go to the health food store and you take a look at some of the excipients and other ingredients in those products, it's really, really bad. A lot of them have all kinds of crazy ingredients in there. And what I like about Stockton Aloe 1, which is the one we use and recommend, is that it's raw and it's incredibly pristine. And what they do is they harvest the aloe and then they send it to you right away. And so it comes flash frozen. And so I don't even think they ship on the weekends to avoid, the excessive heat, in the summertime or things like that. And they only ship a couple days a week. So this is really, really fresh. And what's awesome about aloe is that there's over 75 different active compounds in aloe, everything from vitamins, minerals, enzymes, amino acids, long chain sugars like polysaccharides. It's really amazing for wound healing and gut healing, as well as aging. And it's antibacterial, it's antifungal, it's antiviral. And one of the most powerful components in aloe vera is this product or this substance called ace-mannan. And it's an immune stimulator, like an antiviral, and it induces macrophages to produce interferon as well as interleukins and tumor necrosis factor A. So I can't really say anything more than that, but you can probably understand where I'm going with that. This is an incredible product. It's raw, it's hand harvested, like I said, it's unfiltered, unprocessed. It's not heated. There's no preservatives, no chemicals, and it's just a great, great product. So what you can do is thaw out like an ounce or two every day and just drink it. And talk about a soothing substance for your gut. This is an amazing. I would really recommend doing some bone broth, some aloe, and just see how healthy and how good you can improve your digestion. So Stockton Aloe 1, it's available in the description below if you're watching on video, or at extremehealthradio.com/691 and in our store, biochargeme.com, which is our little store we put together. And if you want to support the show, that's how you do it, is you go to biochargeme.com and go there and buy a couple products, and that helps support the work that we do. So I hope you liked that show with Dr. David Steenblock. That was really informative, really good. I really liked a lot of the things he's doing. So I'm on his website right now, strokedoctor.com, and he's working with EDTA, anti-aging, hyperbaric oxygen, like we mentioned, PRP treatment, regenerative medicine, interesting stuff. And I noticed that he made it on to, when I searched his name on Google, to Quack Watch, which is pretty cool. Sorry, I'm turning on my SOTA magnetic pulsar. So while I'm doing the show here, I'm doing my magnetic pulsar on my tendon. See, I got a little injury on my toe or on my foot. On the top of your foot, where the ankle is on the top, you have that tendon right there, really thick tendon. I did something to it a while back. I don't know what I did. I bent down wrong or something. I don't even remember doing it, but it's incredibly painful. And I don't know about you guys, but if you notice that ligaments and tendons, they take a long time to heal. And so what's a bummer about that is I like to walk and play basketball and hiking and surfing and all that kind of stuff, and I just can't do anything. So what's cool, I've been using this magnetic pulsar by SOTA. We have this in our store as well. And I've been combining the three things. So I've been doing the magnetic pulsar. I've been doing the Q laser, low-level laser therapies. I've been going back and forth. The SOTA magnetic pulsar emits a pulse magnetic field. And I really recommend this thing a lot. You can get them from SOTA. Those are in our store as well. But you can use this all over the body, on your thyroid, over your liver, anywhere you want on your body. So I've been doing a 20-minute cycle of that, and then I do a 3 or 4 minute cycle of the Q laser, low-level light therapy. And then after that, I put some DMSO on there and let that kind of just settle in and dry and drive into the body some extra oxygen. And then let that sit for about a half hour, and then I'll repeat that whole cycle. And I tell you, I've been probably 70% better, which is incredible because, historically for me, tendons just take a long time to heal. And this, I've noticed a difference in a couple days. So this is pretty cool. Anyway, just wanted to share that with you. That was episode 691. So I'll put links to everything we talked about at extremehealthradio.com/691. And I hope you guys enjoyed that show. Like I mentioned before, this is part of my work, is to bring to you and create a platform so that people like him can have a conversation and we can talk about some of the practices he's doing. And I like doing that because this is something that not a lot of doctors or people know about, and, information, it's a war on information right now. There's so much censorship and so much information is being suppressed. And when people don't realize what their options are, not only do they get scared, but they get easily manipulated and fearful. And part of what I do is to give people a platform to let you know that there's options out there that aren't going to be talked about by Dr. Fauci or the CDC or the FDA or your doctor. These are people that have dedicated their life to some of these alternative treatments. And this is what I like to do, is to promote people like this, because it's not my job to prevent you from taking a vaccine or from taking the vaccine or convincing you of anything. My job is to prevent or to present people that are doing really amazing work and then let you decide. So that's part of what we do. So I hope you guys enjoyed that show. And what I like to do as well is I really recommend, if you want to take your health to another level, come and join us inside the Extreme Health Academy, because as you can imagine, I'm exposed to so much content. This is episode 691, right? And so I've done 691 shows, but honestly, the majority of what I learned doesn't even come from this show. So I've been doing research in alternative health since 2003 when I first got involved in this. So that's, 18 years ago. So I've been living this and studying this for 18 years. And you can imagine the different amounts of people I've talked to and researched, everything from spiritual, emotional issues, from magnetic therapy to, minerals and balancing your minerals, to light and photons and biohacking and all the different aspects of health. And these are all areas that, I'm not an expert in any one of these areas, but I'm rarely exposed to something I never at least heard of before. And so there's many different ways to heal the body, many different ways to shear a sheep, as they say. And what I like to do is aggregate some of that together for you. So let's say you're dealing with something and, for example, different people are in different places with their health. Some people have tons of money but no time. Some people have tons of time but no money. Some people have a little bit of both, but they're with a ton of desire. Some people have small amounts of both but very little desire. Some people just want to take a pill. Some people really want to get to the root cause of what's causing their issues. And so all of these different things, I'm putting together different aspects of health and healing that can help people. And so this is what we do inside the Extreme Health Academy. So I'm not going to tell you that light therapy is going to be the fix or balancing your minerals is going to be the fix for everything, but I can bring together a bunch of different foundational aspects of health and healing to something that's workable and manageable for you. So this is why I created the Extreme Health Academy, is for me to be able to connect with you guys. We got a lot of, as you can imagine, emails from people around the world, and it's really challenging to get back to everyone. And what I like to do is to bring together different listeners and different people, different practitioners, and come up with a plan that helps you. So this is what we do inside the Extreme Health Academy. So every Friday morning, I'm live in there for an hour from 9 a.m. to 10 a.m. Pacific on Friday mornings. And we have a really awesome group chat about different things we're trying, different group challenges we're doing, and different things we're implementing into our own life. And then my wife, Kate, does the Women's Wellness Hour on the first and third Wednesdays of every month, which is also live. We've got Dr. Bergman live on the third Sunday of every month. We've got live workshops with practitioners where we go much deeper than we can on the radio show and talk about things that we can't really discuss in a public forum. And so we do that, live workshops with practitioners from around the world, as well as the Ask Dr. Bergman section where you can ask him a health question. You can ask me a health question. We've got courses and workshops and all kinds of cool things happening. So this month we're working on blood donation. And next month, we're going to be working on supporting our livers as a group. So if this sounds interesting to you, there's a free 2-week trial. And I really recommend joining. We just launched the Extreme Health Academy podcast. So what we're doing there is we're putting all of our video content and courses into audio format, which is cool. We've been getting so many requests for people to be able to consume content on the go. And so this basically essentially is an audio version of all the content that we've done: Q&As, live sessions, live group chats, courses, workshops, all that stuff in audio format. And so it's a private podcast that you only get access to as an active member. If you cancel or pause your subscription, you'll lose access to that. So this is a really great way to dive deeper and learn about some things you probably never heard of before. I love Dr. Ray Peat. I love Morley Robbins and Dr. Massey and these light and minerals and things. So we're bringing together all kinds of unique forms of information that you probably never heard of before. And so I really recommend joining. I really, really recommend joining, because like I was mentioning before on our academy, is that you really can't just let your health slide and not take active control over your health, because you do not want to end up in a hospital. That's not something that you want to do, because you're giving away all of your rights at that point. And, if you alter your environment, lots of different ways that I can share how to do that, your body just fixes itself, because your body's constantly trying to find homeostasis. Problem is that we have an internal and external environment that's polluted. And when you fix that, you don't even have to work on your diet. Like, forget about your diet. Diet's really important, but it's not even close to being the most important. The most important is your internal and external environment, and how your physiology and your mitochondria react to that is the name of the game. So, that's huge. That's huge. And so there's all kinds of mitigation strategies like we talked about and discussed further inside the academy. So I'd love for you to join. And if you guys want, if that sounds interesting, and again, what I want to mention is that you get what you put into it. So the members that show up on the live sessions and really make friends with other members, we have a whole members map in there where you can find other members in your area, and you can post a marker in your location and find other people in your area. But the people that put in and invest make friends and get the most out of the website. So I really recommend making friends with the community there, finding other people that are there to help you, and making friends and really, really diving deep and learning as much as you can and finding a supportive community. So anyway, that's our little pitch for our academy. I'm really proud of it, and it's a work and a dream that I had many years ago, and I'm really excited about getting to meet all of you. So if you guys want a free 2-week trial, check that out. It is extremehealthacademy.com. I'll put a link to it at this show page. And then the 2-week trial code is EHR, like Extreme Health Radio, EHR14. And that will give you a 2-week trial, and you can join the forums. You can subscribe to the podcast, the private members-only podcast, and tag me in the forums. And I love, love, love getting to know you guys and meeting with you and hanging out with you and making friends and supporting you and encouraging you and giving you some biohacks, some tips and tools that you maybe have never heard of before. So it's just something I really love to do. I love helping people and getting to know you guys and developing a really cool community. So if you want to take your health to new levels, that is the place to go, extremehealthacademy.com. All right, guys, so that was episode 691. I'll put links to everything we talked about, strokedoctor.com, Dr. Steenblock stuff, the different sponsors we had for today's show, the sauna therapy device, the relaxed far infrared sauna, the aloe vera, along with the molecular hydrogen and the Magnetico mattress pad. Everything will be available at extremehealthradio.com/691, as well as the links to the academy. So hope you guys are doing well wherever you're listening to this, and do me a favor, tag me on Instagram, share our stuff. I would really appreciate that. I love to see what I love is like seeing where people are listening. Like, that's really cool when I get a tag or something and you say, I'm listening to Extreme Health Radio, I'm at the beach, or I'm on a run or something like that. That's really cool when you share it in our stories and stuff like that in your story. So that's really cool. I really get a charge out of that. So I appreciate that. All right, guys, thank you again for everything, for your support over the years, for buying through our Amazon link, for supporting us on a monthly basis, if that's what you like to do on Patreon, and shopping our store and checking out our academy. I really appreciate you guys so much. So I appreciate you all. You guys are amazing. Thank you again. I don't know what else to say, but thank you for all that you do. And I will see you next week. Oh, I forgot to tell you. Shoot, I can't believe I forgot to tell you. Morley Robbins is coming up next week. Whoops, what's going on here? Huh, I can't hear that. Yeah, Morley Robbins is coming up next week. He's going to talk about the 3 ways that copper harnesses oxygen on planet Earth. Dr. Stuart Nunley, we did a whole workshop with Dr. Nunley. Wow, that was powerful. And we're going to be talking with him the next Friday after that. Cass Ingram, Dr. Michelle Lamassa Schrader, Jason Peral, we're going to talk with him about ancient methods of healing body, mind, and soul. A lot of cool stuff coming up. So make sure to subscribe to the Extreme Health Radio podcast. I'd appreciate that so much. That would be great. And I'll see you guys next week at 10:45 a.m. And for Academy members, 9 a.m. Pacific on Friday. Love you guys. Bye.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog is discussed in the context of numerous conditions, it can be dangerous to take action based on any information in this blog or to start any health program without first consulting a health professional. The content found here is for informational purposes only and is in no way intended as medical advice, as a substitute for medical counseling, or as a treatment/cure for any disease or health condition, and nor should it be continued as such. Always work with a qualified healthcare professional before making any changes to your diet, prescription drug use, lifestyle, or exercise activities. This information is provided as is, and the reader/viewer assumes all risks from the use, non-use, or misuse of this information. No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself